Mom, here is a 58 years old male Vandu Murugan who is advocate by occupation, presented with fever, hypotension, elevated total counts, elevated lactate with Q SOFA of greater than 2. So we diagnosed him as sepsis with septic shock.
Hold on. Q SOFA doesn't diagnose sepsis. Sepsis is actually when there is a source of infection along with more than or 2 equal to score of SOFA. SOFA consists of altered PO to FO2 ratio, bilirubin, creatinine, altered urine output, and so on so things.
Then what are these Q SOFA and used to score all this, ma'am?
Good that you asked. Q SOFA is actually a bedside risk predictor and it consists of raised respiratory rate of more than 22 and systolic blood pressure less than 100 along with altered sensorium. Whereas NEWS is actually to identify early deterioration in case of sepsis. You tell me, how did you come to a conclusion of septic shock in this case?
As the patient has hypotension at presentation, we diagnosed him as sepsis with septic shock.
No, that's not right. First, you have to give fluid resuscitation where you are giving crystalloids of 30 ml per kg. Then you assess your signs of improvement in terms of your decreasing lactate trends or is there any improvement in consciousness and all. If there is no improvement, then you diagnose him as septic shock. That's when you start your vasopressors to maintain a MAP of more than or equal to 65 millimeters of mercury. Now you tell me something about sepsis 1 hour bundle.
Within 1 hour of arrival, we have to measure lactate. We have to send blood for cultures and sensitivity. Then we have to administer broad spectrum antibiotics. Then we have to give adequate fluid resuscitation. We have to consider vasopressors. There is persistent hypotension.
So identifying sepsis early and using all these tools will be of great help in your clinical practice. Save this reel and save many lives in ICUs. Thank you.